Welcome back to part 66 of our 100-part CPC exam series. We are diving right in today, but first, make sure to like, share, and subscribe to Decode Healthcare with Harshal. All right, today is a big one. We're moving away from just learning the modifier rules in theory, and we're actually going to apply them. We're talking timed, high-stakes case study dissections, just like you'll see on the actual exam. Let's get into it.
Here is our roadmap for today's explainer. We'll be hitting E&M modifiers 25 and 57, post-op returns, bypassing NCCI edits, split billing, and then wrapping it all up with a really handy modifier cheat sheet.
All right, Section 1, Case Study 1, EM versus surgery.
So this is a massive pitfall on the exam, choosing the right modifier when an evaluation and management, or E&M service, happens on the exact same day as a surgical procedure. Let's look at this scenario. In Scenario A, a patient comes in for an established visit and ends up getting an unexpected minor joint injection. But in Scenario B, an emergency department evaluation leads to an immediate decision for a major abdominal surgery. So what modifiers actually apply to these E&M codes?
The distinction here is absolutely critical. For that minor joint injection, we're going to use modifier 25. Now, you got to know this one is heavily audited, so you absolutely need clear documentation of a significant, separately identifiable E&M service. On the flip side, modifier 57 is strictly used when an E&M results in the decision to perform a major surgery.
So what does this all mean for you? Here is your definitive CPC exam decision rule. The global package length dictates your modifier, period. If the procedure has a 0 or 10-day global period, your EM needs modifier 25. But if it's a major surgery carrying a 90-day global period, you're going with 57.
Okay, moving on to Section 2, Case Study 2, Post-Op Modifiers Deep Dive. Let's step into our second battleground. We're dealing with patients who return to the clinic or operating room during an active global period. Picture these three patients. Patient 1 is back for a planned second-stage tumor reconstruction. Patient 2 had an unplanned return to the OR to control a post-op hemorrhage. And Patient 3? They're in a 90-day global period for cataract surgery, but show up for a completely unrelated wrist fracture cast.
Let's break down exactly how these differ. Modifier 58 is the one you want for that planned reconstruction. Modifier 78 covers the unplanned hemorrhage complication. And Modifier 79? That's for the totally unrelated wrist fracture. Now, pay close attention to how these impact the global period clock. This is absolute gold for the exam. Here is your high-yield takeaway to help you instantly eliminate wrong answers. Planned procedures using 5-8 and unrelated procedures using 7-9 will completely reset the global period clock. But, and this is a big but, unplanned complications using 78 do not reset the clock. Why? Because payment is just for the intraoperative portion. Lock that logic in. Onward to Section 3. Case Study 3, Overcoming NCCI Edits.
Now this right here is one of the highest risk audit areas in all of medical coding. Bypassing NCC edits legally. Improper unbundling will trigger massive audit failures. And let me tell you, the OIG heavily scrutinizes modifier 59. So, if a surgeon excises two skin lesions on completely different anatomical locations, how do you legally unbundle that edit without getting flagged? Well, while you might be super tempted to just slap on the generic modifier 59, CMS actually prefers the highly specific X subsets to prove that distinctness. Let's look at them. XE is for a separate encounter. XS is for a separate structure or organ. XP means a separate practitioner, and XU is for an unusual non-overlapping service.
So for the exam, here's your decision rule. If the scenario screams different anatomical site or separate lesion, XS is your cleanest conceptual match, separate structure, right? If the patient left the facility and came back later that same day, you use XE for separate encounter. Basically, try to use these over 59 whenever the payer allows it.
All right, almost there. Section 4, Case Study 4, Split Billing.
This one is all about separating the physician's brain work from the facility's physical equipment. Consider this scenario. A radiologist interprets a chest CT, but that CT was actually performed using the equipment over at a local community hospital. The physician reading the film doesn't actually own the machine. So how in the world do we code this? It comes down to two components. Modifier 26 covers the professional component. That's the physician's interpretation and their written report.
The TC modifier, on the other hand, covers the technical component, meaning the hospital's actual equipment and their staff. Now, if one single entity did both of these things, you just bill a global code with no modifier at all.
Which brings us to our final decision rule to lock in the split billing logic. If the vignette says interpretation only, you append 26. If it says facility equipment only, use TC. And like we said, if the exact same entity provided both the machine and the read, you just bill it global.
And that brings us to Section 5, our outro and modifier cheat sheet.
Huge congratulations on surviving these case studies. You are well on your way to mastering these major exam pitfalls. I highly recommend you screenshot this rapid-fire visual summary for your final exam prep. Just to quickly recap, 25 is for minor procedure, E/M's 57 is for major. 58 is planned, 78 is an unplanned complication, and 79 is totally unrelated. Oh, and remember to use XS for a separate structure and 26 for professional interpretation. You've got this.
So what's next? Part 67 is our Anatomy and Terminology Masterclass. Are you tired of trying to brute force memorize the entire medical dictionary? I mean, who wouldn't be? But what if you only needed to know a handful of integumentary prefixes to decode literally any complex term on the exam? We're going to crack that exact code in our next explainer, so I'll see you there.